Hi, I'm Trish Cooper. I'm a travel health nurse and I've worked with study abroad for probably about the last 10 years. I want to talk with you about preparing yourself health-wise for your study abroad term. First of all, you'll probably get a form with all the paperwork that you have to fill out for your study abroad that's a medical form. Please be sure to disclose all health information, including immunizations, if they ask for that, but in particular chronic health conditions. You'll meet with a healthcare provider prior to your study abroad as well. Again, disclose all health conditions that you deal with. None of this is meant to keep you from studying abroad, but to make sure that you prepare safely for study abroad and that anyone who's involved in your care while you are studying abroad knows the health conditions that you have. In this age group, the primary conditions that we are concerned about are asthma, diabetes, any mental health conditions that you have, or autoimmune diseases such as rheumatoid arthritis or ulcerative colitis. And make sure that you will have a full supply of those medications. Again, plan ahead on this. It can be really difficult to work with your physician and your insurance company to get that all together. It can take several weeks, particularly for some medications that are considered controlled substances here in the U.S., such as Adderall or Ritalin. Those may not be legal in the countries that you're going into, and they may have restrictions for how many refills you can get simultaneously here in the United States, so plan ahead. Also check with the study abroad office or with the program that you're attending to see if your medications are legal in that country and if you're allowed to bring them in. You may need to figure out some ways to get the medications in safely so that they remain with you, but just plan ahead for this and usually it works out great. Carry on all medications in the original prescription containers that are labeled for your use. That way, anyone who questions you about the medications can see that they're linked directly to you. You never want prescription medications or any non-prescription medications that you depend on a daily basis to be out of your control in checked luggage. As far as non-prescription medications, make sure that you take along with you the ones that you really depend on, you really like on a consistent basis, because they may not be available in the country to which you're going. Carry copies of your prescriptions and carry copies of your eyeglass and your contact lens prescription as well. It'll be easier to replace those if they're lost or damaged if you have that prescription with you. Also talk with your doctor about any travel medications that you might need. Perhaps you're going to a country with a malaria risk, or you know that the food and water isn't always on the safest side and you would need something for traveler's diarrhea. Or perhaps you're traveling to a high altitude destination like Cusco, Peru. You want to talk through all of those medications with your doctor prior to travel to make sure that you're set. And remember to talk with him or her about any side trips that you're going to be taking into areas that might be higher risk than where your program is. All right, so let's talk about your health while you're actually studying abroad. I really want to focus in for a minute on mental health. Study abroad can be stressful, not just because everything's different, everything's new, you're so far from home, there might be a new language, you're separated from the people and the just the social structure around you that normally gives you a lot of support, and so it can be very stressful. In preparation for this time, if you do have a mental health condition, something like depression, anxiety, bipolar, or even chronic insomnia, we do recommend that you disclose that to your on-site study abroad staff. You want someone to have your back while you're there. Now, as far as your sexual health, this is something that you really do need to plan for before you study abroad. Studying abroad, as the slide says, is known to increase incidence of casual sex and unprotected sex. Sometimes the unexpected happens. When you are pulled away from your normal surroundings, you may behave very differently than you have before. So just be aware that you will need to protect yourself in these situations. So how we do that is in advance when you're with your doctor, talk with him or her about your sexual health needs. For women, it's your birth control. Talk with them about oral contraceptives or IUDs. For both men and women, it's planning ahead and taking some condoms with you, which are readily available here, either drugstores, groceries, or at Campus Health for free. But they may not be as readily available to you when you are in your study abroad location. Just remember, study abroad, when you are studying abroad, unprotected sex can still lead to sexually transmitted infections, HIV, hepatitis B, which is sexually transmitted, scabies, and of course for women, unintended pregnancy. Now on that last point, what I often recommend to women who are traveling abroad is that they consider taking a packet of emergency contraception with them. That can be purchased over the counter at any pharmacy. You don't need a prescription, and you all are of an age where no one will question your age, but you can purchase this and take this along with you in your carry-on. Should you have unprotected sex, you may not have that resource available to you while you're studying abroad. And not all unprotected sex might be consensual. We hate to think about it, but there could be an involuntary sexual experience while you're there. Make sure that you have with you the resources that you would need to protect yourself. I know someone else is talking about safety while you're studying abroad, including sexual safety. But just remember, be mindful of your body, be mindful of your surroundings, and just use your head. Don't let your judgment be clouded by alcohol. So here's some other travel precautions that we're going to go through at a fairly high level because they will depend on the country that you go to and the particular risks that are there. So insects, our favorite. We're exposed to many insects here and just don't even give them a thought. But do research the insects that you will be exposed to while you are studying abroad. It's just for your own safety. So know, are you going to be someplace where you're at risk of malaria, dengue, fever, Zika, Lyme disease, any of these? Will you be exposed to mosquitoes? Are they daytime biting? Are they nighttime biting? How can you protect yourself from these? So you are going to need to take a good insect repellent with you, probably anywhere you go. If you know that you're going to have prolonged exposure outside to daytime biting, nighttime biting mosquitoes or ticks, you probably want to wear long sleeves and long pants. Consider taking insect repellent treated clothing with you if you are going to be outside hiking or in an area where there's particularly high risk. If you know you're going to be someplace with mosquitoes carrying malaria and that is a risk factor for you, consider taking a bed net with you. You can find these online. A lot of them can be easily installed above your bed and drape around you to provide another measure of protection. Now the Zika virus came around about 2 years ago, and while it's carried by mosquitoes and you don't get very sick from it, a lot of people never even know they've been infected. It is easy to transmit through other mosquitoes that bite you and then bite someone else. So the thought that I would like to leave with you is when you protect yourself against these daytime biting mosquitoes in a high-risk area for Zika, you are protecting the next person that the mosquito bites. And oftentimes that next person could be a woman who is pregnant or about to get pregnant. And women who are infected with Zika have a much higher risk of losing the pregnancy or of delivering a child with serious cranial and brain malformations. So take care of the next person and protect yourself from Zika. Now sun exposure, that's something we deal with here in the US a lot too, but just again, think ahead. Are you going to have more sun exposure than you're used to? Are you going to be at higher altitudes because you actually have greater sun exposure if you are at higher altitudes? So just go ahead and pack some sunscreen with an SPF of 50 or above. If you find yourself in a situation where you're going to have a lot of exposure, protect yourself with clothing. That's one of the best sunblocks around. Also, look at your prescriptions. Talk about this with your doctor. Make sure that you know if any of your medications increase your sensitivity to the sun and plan ahead for that. Again, something you need to know about is the safety of food and water in the country to which you're traveling. In many Western European countries, there really isn't a thought about this at all. But if you're traveling outside of those areas, do your research online. Is the water safe to drink straight from the tap? Or do you need to drink commercially bottled water? If the water isn't safe from the tap, then only trust water that is sealed and commercially bottled. You want to have to break a seal on the bottle in order to trust that the water is safe. In terms of food, usually safe, well, that's hot food, because high heat tends to kill most germs that cause travelers diarrhea. But be very careful about food that has been sitting out, heated to the same temperature at which it would have been cooked, or isn't it being refrigerated. Anything longer than 2 hours, you want to turn away from that. Riskier foods tend to be raw foods that can't be easily peeled, and that you aren't cooking. Raw foods such as carrots, salads, anything like that could harbor a lot of bacteria on it, and it's really a good idea to stay away from those unless you know that they have been very safely prepared. You do want to also stay away from raw meat and seafood because you don't know how that's been handled. As far as street food, and I have to admit, this is my particular weakness, and what lands me back at the hotel with 2 days of traveler's diarrhea is the street food. It tastes delicious. It's so tempting along the street. The price is right. But you don't know how the food has been handled, how it's been prepared, and oftentimes it's going to backfire on you. So just be very cautious about street food. Know your risk. Tattoos and body piercings. As you travel, you may find some great deals on tattoos and body piercing. Be aware, though, that the safety standards and the levels of hygiene may not be similar to what you're accustomed to here in the United States. We know pretty much any place, or most places, can be trusted here in the U.S. But we don't know when we pull up to a stall in Thailand offering a wonderful big tattoo for $15. We don't really know, is that a sterile needle they're using? We've talked a lot about various health hazards that come from germs that you'll encounter. But the number one cause of hospitalization is really injury, bodily injury while you're traveling. And so we do need to spend a few minutes on that. As the slide says, 18 to 24% of deaths abroad are caused by preventable injuries. Of those preventable injuries, the very top cause are road traffic and motor vehicle injuries. So remember the same safety precautions that you would take here in the U.S., such as not wearing a seatbelt, not using your phone while you're driving. Be very, very cautious about driving at night. Never drive impaired. And if you're riding a scooter, a motorcycle, a bike, make sure you always wear the appropriate safety gear, which at a minimum would be a helmet. But also be aware of traffic conditions where you travel. Don't take for granted that people actually stop for a stoplight, that they'll pause for you or stop if you're crossing in a crosswalk. Be very careful. Ask local people. See when they're crossing. It's very hazardous, oftentimes in traffic that you're not familiar with. Another hazard that we don't really consider when we talk about travel health a lot of the time is hazard that occurs around water. There are many, many accidental drownings that happen every year with tourists, with study abroad. So be careful in the water and aquatic activities that you take advantage of. know, is this boat safe that I'm getting on? Are the people that I'm traveling with safe? Are they looking after my well-being? Am I snorkeling in a place that is safe, that there are resources around if I need help, and that I have a buddy with me? If I'm scuba diving, am I with a reputable company that has good reviews, that is appropriately licensed in the country, so that I know that the equipment I'm using and the people supervising me are safe? But there are other injuries to consider too. Depending on where you are, you may choose to do some optional activities that you pay for on your own that are adventuresome, they're exciting, and they might be a little bit dangerous too. So you need to really think these through as you're preparing. I have seen injuries in my years in travel health. A student who was gored racing the bulls in Pamplona. He didn't win, and spent months in the hospital in Spain. I've seen a girl who fractured her back when she was cliff diving in South Africa. So there are any number of opportunities that might present themselves, but remember your common sense. Don't mix a lot of this with alcohol. Don't make impulsive decisions. As you're traveling around in the region, in your country, or between countries, you may choose to take small aircrafts or airlines that you're not familiar with. Do your research. Make sure these are safe. And then the last one, carbon monoxide poisoning. We've really gotten good in the U.S. about having carbon monoxide monitors in our homes to make sure that we aren't poisoned by something that we can't smell. So it's not a bad idea to travel with a small travel-sized carbon monoxide monitor with you that you can take to your hostel, your hotel, your homestay, just to keep you safe while you are traveling. So when do you go to the doctor, and when do you seek care in the emergency room or in a hospital? Well, in general, my guideline would be go to a doctor if you've had a fever of 101 or more for 24 hours. If you are having profuse watery diarrhea, that's also a clue to go to the doctors, or severe and frequent vomiting. And when I say go to the doctors, I mean try and get in that same day. Don't wait another day or two if they're booked up. Try and get into a doctor that day. But head straight to a hospital. If your fever now has climbed to 103, or if that 101 fever has persisted for several days, head straight to a hospital. If for any reason you are getting kind of fuzzy-headed, you're confused, you're disoriented, or the profuse watery diarrhea has persisted and it doesn't seem like anything's staying down, the vomiting continues, we don't want you to get dehydrated, head to the hospital. If you get a very severe headache that is out of the ordinary for you, head straight to the hospital. I would really urge you, and you'll probably get an orientation in this, but know how to contact emergency responders in your home country. And you won't be able to call 911, so know what their equivalent is so that you can call for help immediately for yourself or someone else in your group when you need to. But for most healthcare situations that aren't an emergency, your on-site staff will be the best resources for you to help you connect with physicians and know where to go. So when you're planning prior to your departure, Campus Health Services can do a pre-departure travel visit for you and help fill out the forms that you need completed. We have a refrigerator full of all immunizations available, and we also have providers who can help talk through any chronic health conditions you have to make sure that all your medications are current, you're being treated in the optimal way for that. We can also help you with your sexual health needs for both men and women. And we have psychiatric providers there who can help you with any issues that need to be addressed prior to travel, or help you with any issues that you feel you will be facing while you are traveling. Again, the CDC is just the world's best website, I think, for researching what you're going to encounter in country and for the precautions and the health care that needs to be obtained in advance. Thank you very much for the opportunity today. I wish you a great trip.